Hello, and welcome to Tokyo Anesthesiology Clinic. This is the first episode in our special series. Today, we'll be speaking with our medical director, Dr. Tori, about his background and our clinic's approach. Please note that this video is intended to provide general medical information for the public. It is not a substitute for individualized medical advice, diagnosis, or treatment. If you have symptoms, please consult a qualified medical professional. In an emergency, seek emergency care immediately. In this episode, we are using an AI-generated avatar and synthesized voice and video of our medical director. The content itself has been reviewed and supervised by Dr. Tori.
Hello, I'm Dr. Tori, the medical director of the clinic. In our introductory series, we explained ketamine therapy in general terms. In this special series, I'd like to talk about our clinic's approach and the path that brought me here. In this first episode, I'll explain why I started a ketamine clinic.
Doctor, could you begin by introducing yourself?
For more than 20 years, I've worked mainly in pain medicine in Nagoya. In the care of chronic pain, we often see not only pain itself, but also insomnia, anxiety, and depressed mood. That is why I've practiced from both pain medicine and psychosomatic medicine, in other words, care that looks at the body and mind together.
Some viewers may find it surprising to hear psychosomatic medicine mentioned in a pain clinic.
But in day-to-day clinical practice, it is quite natural. Chronic pain often overlaps with insomnia, anxiety, and depression. The autonomic nervous system is often involved as well. If you separate a person into just the body or just the mind, treatment can stall. That is why I've always tried to look at both together.
Where did that interest begin for you?
From the beginning, I've had one central question: how should we understand and care for human suffering? Pain, anxiety, and depression may take different forms, but for the person experiencing them, each can disrupt everyday life.
Did that also lead to your interest in psychiatry?
Yes, since high school, I've been interested in forms of suffering that are difficult to put into words and in the unconscious mind. That remains one of the central themes of my clinical work even now.
I understand that dreams and psychoanalytic perspectives have also been important in your clinical work. Many viewers may not be familiar with that, so could you explain how you think about it?
Yes, I have always placed great value on the patient's own account of their experience. As an extension of that, dreams can sometimes offer useful clues, so I have paid attention to them for many years. In psychoanalytic thought, dreams are sometimes understood as expressions of the unconscious. That said, I'm not saying that dream analysis itself is a treatment that cures people. My position is different. I see this kind of information as a way to better understand a person's condition, make better clinical judgments, and think more carefully about how to structure treatment.
So this is not a treatment in itself, but rather a way to improve the accuracy of understanding.
Exactly. As part of my training, I also studied clinical psychology in graduate school and took courses in psychoanalytic theory and cognitive behavioral approaches, not because any one of those is sufficient on its own, but because I wanted to build a broader set of tools for understanding human suffering.
When did you first encounter ketamine?
I first worked with ketamine during residency. I used it both in pain treatment and as a medication in general anesthesia. In medicine, ketamine is used as an anesthetic. At the same time, in Japan, ketamine is legally classified as a narcotic drug, which means it is subject to strict controls.
Many people feel uneasy when they hear that.
Let me keep this brief. Possession or use outside legitimate medical purposes is strictly regulated by law. So in medicine, ketamine must be used within a clearly defined framework: purpose, dose, clinical setting, monitoring, and readiness for emergencies. Safety depends on how the treatment is structured and supervised.
There's a lot of exaggeration and misunderstanding online. Is your clinic trying to provide an altered state of consciousness experience?
To be clear, no. Our clinic does not use ketamine for the purpose of producing that experience itself. We only use it as a physician-supervised medical treatment for pain or mental health symptoms after careful evaluation. During treatment, some people may feel as though they are dreaming, notice changes in their sense of reality, or experience temporary changes in perception, sometimes described as hallucination-like experiences. These responses vary from person to person, but in medical practice, patient safety comes first.
What do you mean by safety specifically?
Blood pressure, breathing, drowsiness, and how calm or agitated the patient is. We monitor these carefully to reduce risk. That is the foundation.
How would you describe the role of ketamine treatment at your clinic?
At our clinic, ketamine treatment is provided on a self-pay basis. We make individualized decisions based on a patient's medical history, comorbidities, current medications, and psychiatric symptoms. Response varies from person to person, and it is not a substitute for standard treatment.
So it is not for everyone.
That's right, and that is exactly why we place so much emphasis on careful evaluation and safety management.
To close, could you briefly summarize today's key points?
For many years, I have been thinking about how best to understand and care for human suffering. That means trying to understand the background of suffering carefully, including a person's own narrative and, at times, their dreams. At the same time, through anesthesiology and pain medicine, I have trained rigorously in safety management. Ketamine treatment, as medical care, is an extension of that same work.
Thank you very much. In episode 2 of this special series, we'll discuss two of the main concepts often used to explain how ketamine may work: neuroplasticity and the salience network. We'll explain them as clearly as possible. We'll also post a written companion article linked in the description below. This channel provides general information only, and we are unable to respond to individual consultation requests. Thank you for watching, and we hope to see you again in the next episode.